I'm going to read this out loud. You'll demonstrate the blood exposure procedure. You'll imagine the following scenario. During a service, you have sustained a minor cut to your index finger. The injury is such that you can continue with the service. Your work area or client has not been contaminated. You are expected to demonstrate the proper procedure for a blood exposure. You are expected to follow all client protection, safety, and infection control procedures. You'll have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you finished. I just repeated the instructions. You may begin. So when she says you may begin, we are all going to at the same time.
I have a question.
Yes, ma'am.
Will they ever choose your thumb?
I don't think so.
You know, it's not always an index, right? They choose
So that's what they say, but it does say
index.
to your index finger in the proctor's script.
Right.
I don't know if they have license to like deviate from that, but
Just listen to them that day, and if she does
and
say
they
a
repeat
different
it.
finger.
She'll read the directions one more time.
Okay.
So, but for today, for demonstration purposes and practice purposes, we're gonna say it's the index finger on your non-dominant hand, because you would never cut yourself.
I
Hopefully,
wonder if they
on
do
your dominant
switch it
hand.
up just to see how well people are paying attention
I'm
to
sure
directions.
they do. I'm sure they do. Okay, so first thing you do is you sanitize your hands. We're gonna all do this together. Those who have their kit. So you're gonna sanitize your hands. Avoid the injured area, and then what are you gonna do?
You are going to open your first aid kit and get out your bag.
Blood exposure bag.
Blood
Yeah.
exposure bag.
So you're gonna open your first aid kit, and inside your first aid kit, this is a point on the exam. You have to get it from here in order to get that point. What do you do after you take something out of a bag every single time?
Seal it.
Reseal.
Reseal. Oh, if you're not totally taking everything out of the bag. Reseal. So then you can take your blood exposure things, and if you're really paranoid, you can lay a tissue down, but because we're gonna dispose of all this stuff, it really is not necessary. So I'm gonna take everything out of my blood exposure kit bag, I'm gonna reseal my blood exposure kit bag and throw that in the trash. I'm demoing that for now. And then what are you gonna do?
Clean it with the disinfectant swab and
Yes, I recommend before you even start doing that, open up one of those contaminated bags so it's already open and ready to go so you can slip your trash in there as you work. Yeah, you're gonna open your alcohol prep pad or your
Disinfecting wipe.
cleansing thing. You're gonna cleanse the area. What are you gonna do with that trash?
put it
Put in the contaminated bag.
Yeah, you're gonna hang on to it until you're ready to throw it all away. So you
Is it
sanitize
okay,
the
instead
area.
of putting it all in as you go, just collect in your hand and then put it in?
I mean,
That should not be.
yeah, but if you drop it, you've just contaminated,
It's
like
just
everything.
easier to put it in the bag.
yeah, as you go. So that goes in the bag. Then you're gonna take your bandage, you're gonna unwrap it, and you're gonna place it on your injured finger. And then with that trash also, you're gonna put that in your contaminated bag. Then you're gonna put on your glove. Once your glove is on, you can reseal or seal your contaminated first bag. That bag goes into your other contaminated bag, which you then seal. And then your double bagged, dirty, gross, contaminated stuff goes in your trash. You are going to sanitize your hands with your glove on. And then you are going to immediately clean up your stuff. So what I would do first, since your hands are freshly sanitized, is undrape your doll head. All of the stuff that she has on her can go in your soiled linens bag. You're gonna take your SMA off of your manicure table, and that as well goes in your soiled linens bag. And then you're going to, what?
Sanitize your hands again before you go into your clean stuff, because you just touched dirty stuff.
Exactly. You're gonna sanitize your hands because you just touched all of your dirty linens. And you are going to move everything from your workstation to your manicure table. gonna grab your disinfectant spray and 1 paper towel from your bag, your blue towels, which mine are not blue, that's okay. And then you're going to, oh, and your kit bags, don't forget your kit bags. And then you're going to spray down your workstation with your disinfectant spray. Hang on to that, do not set it down if you can help it. You're gonna wipe your workstation down. Once this side of it has been wiped down, you can wipe the bottom off of your disinfectant spray and then continue. Lift up your binder, wipe underneath that binder. And then as you are grabbing your things from your manicure table, you're gonna wipe off the bottom where it touched something unsanitary or unclean. And return everything back to your workstation. When in doubt, wipe it down just in case it got contaminated per the proctor. Okay, once you've done that, this goes into your trash can. You're gonna sanitize your hands. And now you have to disinfect your manicure table. So you're gonna do the same thing you just did. You're gonna grab your paper towels, grab 1 paper towel from your bag, reseal your bag. Take your disinfectant spray, spray down your manicure table. Place that down. And then you're gonna wipe down your manicure table with your towel. Now this goes in the trash. And then you're gonna sanitize your hands one last time. And then you step back and you wait. That's the blood exposure procedure. You do the regular blood exposure procedure that we just did, but then you also disinfect your entire area.
Your head and stuff, you just set it on the back bar, or?
She's still chilling on your
So you just do that
tripod.
like, when, the facial, like you grab the head when it's like facial time?
Uh-huh. The one thing that I would also maybe do during blood exposure is take the foils out, dispose of them properly,
Okay.
and then secure her hair back, like with a clip or something.
You just leave the tripod?
Your tripod just chills.
Okay.
Yep. So, what's next? What's after blood exposure?
Facial.
Facial setup. So you get 2 minutes to set up for your facial. What do you have to do during that time? Are you gonna do a facial with this glove on?
No.
No.
No. No. So, she's gonna say to you, at this point, you have 2 minutes to set up the supplies for the basic facial section of this examination. Please do not begin any procedures until the verbal instructions have been read and you are instructed to begin. Step back to indicate you finished. She'll repeat the instructions and then she'll say you may begin. So you get 2 minutes to set up for your facial. So first things first, she's gonna say you may begin. You're gonna sanitize your hands. You're gonna go into your table setup bag box where you will have 2 bags labeled contaminated. You're gonna close that box all the way. Make sure it's totally closed. And then you're going to, I would grab a tissue and set it down so that you, just in case it's considered contamination, which it's not as long as you're sanitary about it. You're gonna open 1 contaminated bag and you're gonna take off your glove and your Band-Aid kind of in one fell swoop. You're gonna place these items in this first bag, seal it up. Place this bag in this bag. Seal it up. Yeah. And then you're gonna take your tissue and all of this stuff and you're gonna throw that away. And then you're gonna sanitize your hands.
With your finger, it doesn't matter anymore.
Your fingers, it was fake, so you understand it's fake. You don't have to avoid it. You're gonna open your table setup box and you're going to grab your SMA towel. And then very quickly take your entire facial bag. You're gonna dump it out in a controlled manner so you don't lose any supplies. refresh. And then you're going to go about setting up. Don't worry too much about setting up your supplies as long as they're out on your SMA with the labels visible to the proctor. What do you really want to focus on getting done? What do you have to get done before you actually start the service?
Make sure the supplies are all out and your doll is prepped? Or-
Yes, the last part. Make sure your doll head is prepped and ready to go for the service. So don't worry about making everything look pretty. You need to worry more about getting your doll head draped and on your station. So you're gonna prepare your little towel thing that holds the doll head in place. And then I would drape your doll while she's on your thingy with the bonnet and the headband. I would put the headband first normally, but some people are nice. Okay. So you're gonna put the bonnet on her head. And then you can take her off, place her on your workstation. Sanitize your hands because you just touched a person and they're dirty. And then you'll go either, you'll have a towel here or you'll have a towel in your table setup box. I didn't just grab that from the floor, nobody saw that. And you're gonna place this over her neck so that she is considered fully draped. Okay? And then you're gonna sanitize your hands and step back.
Does the headband go inside of the bonnet or outside?
I would put it on the inside just so that it holds all the hair back, and then you can throw the head bonnet on over without worrying about flyaways and like all that stuff, because it's a pain in the butt. But now I'm ready to do the facial. I'm set up. I'm good to go. I don't have to stress about anything. My tripod's hanging out. My stuff is cleaned. Everything is cool. And I don't have a stupid glove on my hand with a Band-Aid on a non-cut. Okay? Does that make more sense to everybody? Does everybody feel good about that? Does anybody not feel good about it?
I kind of am confused a little bit with the list though. You confused me with the 4 contaminated bags. That was on my checklist, so.
No, it's a new thing. It's an added, the 2 extra bags are a new thing. You should always have 2 contaminated bags in your blood exposure bag for your double bagging.
Yeah.
But then you're just gonna add 2 more bags that are labeled contaminated and have them in your table setup box. They're separate.
So where is your, when you do the blood exposure, where's the first aid kit?
It should always be out on your station with your universal supplies, like next to your table
So
setup box.
you take it from the first aid kit,
Yes.
and then you put the first aid kit back.
Yes. Yeah, that stays, because if you accidentally cut a client, or if you cut yourself for real, you need a first aid kit in order to tend to your wounds. Technically, you should have 6 contaminated bags, because you should have a set in your first aid kit, and there will be a set in your first aid kit with your exit kit.
Okay.
But during practice, nobody ever cuts themselves, and if they do, we don't have to actually follow the report.
What if you do cut yourself? Because I've cut myself and every time I go to my fucking
At state board,
Yeah.
don't let it derail you. You don't have to fail just because you cut yourself. If you contaminated anything, you need to make sure you dispose of it properly.
Just do
Your
that.
blood exposure procedures.
Really?
Yeah. But get it from your first aid kit, especially if you do it during the haircut and you still have to do blood exposure later for real.
So we should have like 2, we should have 6, just in case.
You should have 6 total.
Yeah.
Yep. You should have 2 contaminated bags in your first aid kit. You should have 2 contaminated bags in your blood exposure kit. And then you should have 2 contaminated bags in your table setup kit just for disposal of your stuff later.
Right.
Because even though it was mocked, I don't know that they are aware of that. I don't know that they would be okay with you just removing something that was said to have blood, biohazardous stuff on it in just the regular trash. Even though it in reality does not, but in reality you're not also doing a real perm, and in reality you're not coloring somebody's hair, and in reality you're not highlighting anybody, and yada yada yada. Okay. So yeah. Good questions. Anybody else? Any other questions before we jump in? Do you guys all get the disinfection process? Bitchin'. Rat. Cool. Okay. So, do you guys want to keep going and go through the facial
Yeah.
as a refresh? Really quickly? Okay. And then we're gonna read the steps to the nail out loud, but we're not gonna actually do it.